I chose to use SNP nutrigenomics for a number of reasons, actually. First, I've used nutrigenomics as a guiding tool for the past 4 to 5 years in acute and chronic conditions, and particularly in complex cases. Secondly, I usually use an analysis tool that is very complex and can be very time consuming. SNP nutrigenomics is nice, short, sweet, and effective tool for many of these cases. It's an excellent starting point. Thirdly, I've been in touch with the creators of SNP nutrigenomics for about 10 months, vetting the methods and research they've used to build this tool. And I feel quite comfortable and assured about the scientific basis for use. And lastly, there is a very unique and complex yet elegant technology that matches individuals' SNPs with specific nutrient needs. And this results in an individual supplement. And that's huge, a huge innovation in the field. The way that I use the SNP nutrigenomics thus far for patients are those patients who are very complex. For people whose standard labs have come back normal and to whose therapy plans didn't seem to be addressing the problem or hitting the target. So we get to take, essentially with this tool, we get to take a look under the hood, so to say, by seeing what's going on with the 18 or so genes that in mutations that are strongly related to several processes in the body. Code Complex is formulated with unique technology and is individualized for each patient. I'm very excited to see the benefits for my patients, and it's also the economy of it all. I try to prescribe the least amount of supplements for my patients, so maybe to start with 5 or 6 supplements, but even 5 or 6 supplements can be very, very costly. So one formulation, individualized, has everything that person needs, and the SNP nutrigenomics system is very powerful. I'm also a National Institute of Health Research Fellow in Immunology and Oncology, and so the genes that are associated with the immune function, like IL-6 and TNF-alpha, and also inflammation, like CRP, are also included on the panel. So to my colleagues, I would say, while there are several nutrigenomic testing reports on the market, there's a couple of things that differ about SNP nutrigenomics. SNPs selected are on prominent genes, just not the methylation genes that a lot of reports focus on. So again, as my practice focuses on immune dysfunction and cancer, are really important. Second, groupings of the genes on the reports are according to physiological categories, which is extremely important to understand the interaction in matching to your clients or your patient's symptoms. And then thirdly, these results are used to formulate that one individualized supplement. That's the awesome thing. That's the huge thing. That's the thing as a research scientist that drew me in. And that's the thing that kept me going back to the creators of this product and asking questions and making sure that it wasn't a gimmick and that it was something that's long lasting, that it's very effective and efficient, and that's going to be around for a while to help our patients. Lisa Price, Seattle, Washington, licensed naturopathic physician,